So focus groups help us to gain insight. If information is the raw material, insight is the significance of that information. And here we're going to take an example of gaining insights from communities through focus groups using the example of healthcare access in underserved areas. So here we're going to explore a little bit more about question design and how we use the responses to these questions to collect insights on the situation or issue we are studying. So insight and information are different. Information is the raw material, and insight is the result of processing and understanding that information. So insight involves having a more profound awareness or comprehension of a situation or a problem or a concept. Information is just information. So here, in a relief effort targeting improved healthcare access in underserved areas, imagine a focus group that includes local healthcare professionals, social workers, and community members. So this focus group can provide insights on the state of existing healthcare services and needs for improvement or expansion. It can also highlight challenges such as transportation barriers, healthcare awareness, language and cultural barriers, and the need for any specific medical services. These are, of course, just suggestions, and let's be careful about limiting the things that we include as challenges. They're just examples, but if we go into a focus group with a checklist of challenges, we may not hear the things that we don't ask for. So remember that focus groups need openness. They are places to create space to hear fully from the community's lived experience. They're not places for us to get approval or to tick boxes to confirm our preconceptions. We are not looking for validation from the community. To gain any insights, we need to let go of any firmly held ideas and listen. To gain any insights, we need to let go of any firmly held ideas and listen, so we can have broad areas to explore. Not a narrow path to navigate, but an open space. Certainly this space has boundaries, and they are defined, but there may also be things in the adjacent space that have a relevance to what we are investigating. And now, once again, there is a task for you, and in this exercise, visualize this relief effort targeting improved healthcare access in underserved areas, and there's a focus group featuring local healthcare professionals and community members. So, what specific questions would you design to elicit insights on existing healthcare services? And let's remember, insight and information are different. Information is the raw facts. Insight is about gaining understanding, interpretation, and realization based on the information at hand. So it requires context, it requires analysis, and the ability to connect different pieces of information to uncover patterns and relationships. So insight is a higher level of understanding that goes beyond the surface and may involve making connections, drawing conclusions, or gaining new perspectives. So bear this in mind when I ask you, what specific questions would you design to elicit insights, not just information? So the questions you will design are more than just about getting numbers and facts. So design questions that will elicit useful information to understand the situation more deeply, the issues and the themes behind the information. And again, it's okay if this task is a challenge. It's meant to be. Go away, take your time, see what you come up with before you move on. And the second part of the question is, of course, about the practical application. How might these insights guide your efforts to improve healthcare access? So there are quite a number of questions we would have for the healthcare professionals. How would you assess the current state of the healthcare services in this area? What are the strengths and weaknesses of the existing healthcare infrastructure? And in your opinion, how accessible are healthcare services for community members? Are there any financial barriers preventing people from seeking timely medical attention? What resources, such as medical facilities, personnel, and equipment, are lacking in the current healthcare system? And how can existing resources be optimized to better serve the community? How actively are healthcare professionals engaging with the local community to understand their needs? And what strategies could be implemented to improve communication and collaboration with community members? To what extent are preventive care services being offered in the community? And how can healthcare professionals encourage a greater focus on preventive healthcare among community members? And are there any emerging health issues in the community that are not currently adequately addressed? And how can health services adapt to address new or changing health concerns? Notice that none of those questions are really about information. They're all questions designed for insight. They're asking for people's perspectives, understanding, and interpretation of the situation. Moving on to the questions for the local community. Again, we're not asking about numbers and information and data, we have those. This is a focus group, this is about getting insight. So questions around healthcare access, for example, are not about how many clinics are there, but how satisfied are you with the current healthcare services available in your community? And what challenges do you face in accessing healthcare, such as distance, transportation, or cost? Do you find the healthcare services affordable, or are there barriers preventing you from seeking medical care? And are there any specific aspects of healthcare costs that are a particular challenge or a particular burden? How would you describe the communication between healthcare providers and community members? And do you, as a member of the community, feel involved in decisions about your healthcare? And do the healthcare providers explain things clearly? What factors discourage you or prevent you from seeking healthcare when needed? Are there any cultural or social reasons that will affect whether you or other members of your community seek healthcare? And in your opinion, what improvements would you like to see in local healthcare services? Are there specific services or facilities that you believe are lacking? How well informed do you feel about preventive healthcare measures? And what role can healthcare professionals play in enhancing community education? Notice once again, all of these questions are related to insight and not information. Questions like, how do you feel? What, in your opinion? And so on. So what we're trying to do here is to mine behind the information. We want to understand the perceptions and the lived experience of the community. So we have elicited opinions and ideas and information from both the community and the healthcare workers. And their answers will have touched on a range of issues. So what different themes or insights are going to emerge here? What is this next level of understanding we can explore based on analyzing the information and responses that we've gathered? We may have insights on resource allocation, Insights from both groups can guide how we allocate or distribute resources to address specific weaknesses or deficiencies in medical facilities, equipment, and healthcare personnel. We may have insights related to affordability and to accessibility. Understanding financial and geographical barriers can guide our efforts to make healthcare services more affordable and accessible to more of the community. Improving communication and collaboration between healthcare professionals and the community can also lead to a more effective and culturally sensitive healthcare delivery. Recognizing the importance of preventive care and community health education can also inform the development of programs and services aimed at promoting wellness and early intervention, and looking at adaptation to local needs, identifying emerging health issues and considering cultural factors can help tailor healthcare services to the specific needs of the community, ensuring a more responsive and effective healthcare system. So we've just looked at a development effort targeting improved healthcare access in underserved areas, with a focus group featuring local healthcare professionals and community members, and how we would design questions to elicit insights on existing healthcare services. And insights are not the same as information, they go deeper. And we've looked at how those insights could guide our efforts to enhance healthcare access. When we involve both local healthcare professionals and community members in a discussion designed to elicit insight, this focus group can contribute to developing targeted interventions that improve and enhance healthcare access and address the unique healthcare needs of the target community.